Gentleman from South Carolina.
Mr. Speaker, I yield 3 minutes to the gentleman from Tennessee, Dr. Rowe.
The gentleman from Tennessee is recognized for 3 minutes.
I thank the gentleman for yielding. And Mr. Speaker, I rise today in support of the rule and underlying H.R. 436, the Protect Medical Innovation Act. This bill will make a positive impact in two critical areas, jobs and innovation. For 40 consecutive months now, unemployment has exceeded 8%. Just last week, we received the unwelcome news that unemployment had increased in May from the prior month. We're on the wrong track, and the medical device tax included in the Affordable Care Act will make a bad situation even worse. According to one industry study, the 2.3% medical device tax could result in a loss of 43,000 American jobs, and this is just outrageous. We should be taking steps to create good-paying American jobs and not preserving a tax hike that would ship these jobs overseas. Let me just put that in perspective, Mr. Speaker. I have a unique observation point as a physician in practice for over 30 years. And let me take you through some innovations that I've seen. In 1974, I learned how to do laparoscopy, which is where you place a scope inside the abdomen and look, just observe. And that's really about all we could do. I remember in 1986, my partner and I did the first ectopic pregnancy. That's a tubal pregnancy, where pregnancy has occurred in the fallopian tube. And we were in there trying to get this pregnancy out through a scope. We did not have the equipment to do it. Today, you can take an ultrasound, diagnose this before rupture, and before most of these were diagnosed after rupture, required blood transfusions, an open laparotomy, and days in the hospital. Today, I'm happy to report that we diagnose almost all of these before they rupture. We take a simple scope with the new equipment that's been and devices that have been discovered and utilized and developed, remove this and send the patient home within hours. I've watched now this go from just a rudimentary observation to incredible surgery with a Da Vinci the new Da Vinci device. They were able to do very complicated pelvic surgery, prostate cancer surgery, other abdominal surgeries, heart surgeries that have done many things. They've reduced suffering, lowered morbidity, mortality, and we certainly do not need to go in the different direction. Let me give you a very personal example that happened to me just 8 or 9 months ago in September of 2011. I was walking through the airport in Charlotte, North Carolina, when a gentleman arrested. If it had not been for an AED, a medical device, this gentleman would not be here with his family today. We're able to resuscitate him and send him successfully home to his family. We do not need to decrease this innovation. And I've seen absolutely spectacular things that have occurred over the last 30 years. Also, this legislation is very simple. It does two other things. It allows an individual to use their HSA, which I have, to buy an across-the-counter medication instead of coming to my office, the most expensive entry point into the healthcare system other than the emergency room, to get a prescription. It's counterproductive. It wastes time for the patient and their families. I also would certainly support the FSA agreement for letting someone keep $500 of their money.
30 seconds.
I thank the gentleman.
Jones recognized.
And letting that individual and that family roll it over so they can use it the next year. 3 very simple things. And I will close, regardless of what you believe in the Affordable Care Act, or however you believe. I urge my colleagues to support this, and I find it a little bit comical that we are fussing about a closed rule on these 3 simple items when we discussed a 2,700-page health care bill on a closed rule. And with that, I yield back the balance of my time.
The gentleman yields back. The gentleman from Colorado.
I yield myself such time as it may consume.